Hey, this is Dr. Moss with Moss Rehabilitation Center, coming to you today to discuss the 3 common types of low back pain that we see here in the clinic. And it doesn't really matter what the type is because the symptoms are going to vary, right? So your back pain and the symptoms you have, they're kind of like a thumbprint, but there's usually 3 common causes of the pain. Now, you may end up having muscle spasms. You could potentially have some sciatica, which is pain that runs down your leg. But I'm just going to discuss the 3 causes of back pain and give you some tips to help you deal with that. So on the board, I have the vertebrae drawn, and the vertebrae are basically the building blocks of your lower back. Now, in between the vertebrae, we have what's called the disc, and so a lot of people have heard about they've had a herniated disc, or they've had someone that's had a herniated disc that required surgery, or they had a herniated disc that healed. And I'm here to tell you that even if you have a herniated disc, it can heal. Okay, it's soft tissue, and the soft tissue in the body can heal. And so we have this disc here, and when it herniates or ruptures is sometimes a different term, or it can just get irritated because as these bones kind of shift and move, the disc can get a little bit irritated. And when that happens, you can get local pain in the back, and you can also have pain that goes down into your leg, and it's not comfortable. This disc pain typically occurs in people in kind of the mid-20s to the mid-40s. Typically, they feel worse first thing in the morning, and they feel a little bit better as they get up and get moving throughout the day. There are some very simple exercises that you can do to help relieve some of the pressure within the back. However, if you wake up and you have a lot of pain, I recommend using ice for about the first 72 hours. Then you can switch over to a mild heat pack that helps to relax the muscles, and that'll also help to reduce the pain. Also, if you are experiencing this type of pain, the next thing is to ask yourself what makes the symptoms worse. If standing makes it worse, then spend a little bit more time sitting or laying down. And frequently, people feel better when they change positions when the disc is what is causing some of their pain. They may also notice a catch in their lower back or feel that the pain makes them feel weak. They have difficulty leaning over or bending over. So trying to get clothes out of a washing machine or dishes out of the dishwasher or just leaning over to pick up a backpack or a briefcase may be excruciatingly painful. So start with some ice and heat. Early on, within the first 72 hours, go with ice. Then you can move on to heat, and then some very gentle range of motion exercises for your lower back to help loosen that up. Now, the second type of back pain that we have is usually a progression of this disc problem. And as we get older into our mid-40s and mid-60s and 70s, what has happened is now this disc from injuries in the past has gotten smaller. So it's actually kind of shrunk a little bit. So if I was to modify my drawing here, what happens is now this space is a little bit smaller. And now here's the disc here. And what also happens is it narrows or makes this space back here where the nerve comes out. It closes down on this nerve. So this window starts to get a little bit smaller. And so not only do people that are a little bit older that have a narrowing within this space, we call it degenerative disc disease, it just means the clock is ticking and we're getting a little bit older, is that this nerve will start to get a little bit of compression on it. And when that happens, that's typically where people have pain that starts to go down into the buttock, into the back of the leg. Sometimes it's one leg, sometimes it's both. If you experience symptoms like this, you may find that leaning forward on the grocery cart allows you to walk a little bit further, and it makes it a little bit more comfortable. Or if you see your friends or family members walking in a leaning forward type position, they typically have a condition like this, which we call degenerative disc disease. Stenosis is another form of that. And if you have stenosis, then standing up straight or even leaning backwards actually closes this space even more And so what you want to do is you want to do some exercises, say like stretching, bringing your knee up towards your chest to open this up in the back. And so bringing the knees up to the chest while you're laying on your back is a great exercise to kind of open that up. Now, this condition usually happens in kind of the mid-50s and 60s time frame. And these patients usually feel a little better in the morning. And then as they've been up on their feet all day, the gravity starts to take effect and it starts to compress on this disc and the nerve even more. And when that happens, then their symptoms get a little bit worse. And so another thing to do is, if you can, mid-afternoon, before those symptoms start to come on, try to lay down for 10 or 15 minutes in a comfortable position, whether it's on your back or your side. And the studies have shown that that actually starts to bring in more fluid into the disc, which then increases the height just a little bit, and it may help give you some relief for the end of the day. Now, the third type of pain that we see is called pelvic or SI joint pain. And so the SI joint is actually lower on the lower back in the body. So I'm going to draw that. And what we see is the middle bone is called the sacrum here, and above it is you have those vertebrae that we were just looking at that sit above it. But then on each side you kind of have this pelvic bone, okay? And it's the joining of the pelvic bone and the sacrum, so this point right in through here, that we call the SI joint or the sacroiliac joint. And this pain is usually experienced more in females, typically towards the end of their pregnancy in that third trimester. As the hormones are getting going within the body, it causes the ligaments to loosen up a little bit to prepare for childbirth. Now, what can happen is after childbirth, or even after a hard step, or stepping off a curb wrong and you feel like things just kind of got jammed in your leg, that this joint here can actually shift just a little bit. And the joint it's very stable. It has a rough surface because it needs that stability to support all your body weight when you walk and run and things like that. And that joint can get off track just a little bit. And if that does, then something just doesn't feel right back here. Sometimes it's a dull, aching pain. Sometimes it's sharp shooting pain. Stepping and walking with that leg can hurt. Sometimes just sitting is really uncomfortable. And so again, doing some stretches to either bring the knee up to the chest or even stretching to bring the leg back behind you is one way to help relieve some of those symptoms. The other one is called a figure 4 stretch. You can bring one leg over the top and kind of stretch the hip that way just a little bit. But frequently when this joint is jammed, this needs some type of hands-on work by a physical therapist to make that joint kind of go back into place. And then we teach you some specific exercises to help strengthen the back and the glute muscles and muscles around the hip to help hold that joint in place. So if those are some of the conditions or things that you're experiencing, you can go and give us a call at 817-220-6677, and we'd be happy to help. If you have further questions, you can either leave them in the comment section below, or again, call that number, and we'd be more than happy to help. So again, thank you for watching the video. Hope this was helpful. And if you have any questions, please let us know. Thank you.